Hello, my name is Leilane and I am an occupational therapist. I am here to talk for you about Down syndrome and my experience like occupational therapist. I am from Brazil, so will ask you a little patience because my English is not very well and I am doing here my better, okay? I had graduated in University of Brasilia in 2017 and I post-graduated in psychomotricity and postgraduate student in applied behavior analysis, and I am training for sensorial integration certification. I work with children with disorders, disabilities, and developmental delay, and a percentage of these children is DS. First, let's talk about Down syndrome, DS, that we know is a trisomy 21 or 2 or T21. Down syndrome is a chromosomal disorder affecting 1 per 650 to 1000 live births. The DS results in a collection of clinical features commonly we know as DS. But it's important to say and repeat, T21 is not a disorder. T21 is not a disease. It's a generical condition. This syndrome can cause metabolic alteration, physical, cognitive, and sensory. This is important because this information will give us a guide in the intervention, but they are different. They think different, they have cultures, the stimulation and the family where they live is different. So we can't say it's exactly like this, but we have a guide with common characters. I will talk some physical characters and cognitive characteristics. In physical characteristics, we have planets nasal rods. They are short. They have small hands and short fingers. The muscle flaccid is more hypotonic. So we have more children like this, or the body is more flaccidity. We have the single palmar crease and eyes with upward line and skin folds in the inner corners. In the cognitive characteristics, we have intellectual disability, attention difficult to planning, and little inhibitory control. Usually, these kids need a multidisciplinary team, and this team consisting of a doctor, physiotherapist, occupational therapist, psychologist, language and speech pathologist, social worker, and special educators. Um, the, we, occupational therapists, work with the rehabilitation or the habilitation in the functions in activities of daily living, organization of the integration sensory, and quality routine in different environments at home, at school, at playground, at the grocery, at the work. So we think in the priority the occupation. And when we think the occupation of a children, of a child, we need to think in the first how they play, because they are player. This occupation is very, very important in the childhood. And they are two students. They almost learning something. They are son, daughter, sister, brother. We are talking about children, because when we talk about adults, we have more occupations to put in this list. So for occupational therapists, we understand that we need basis to be functional in the performance activity of daily living. This base we call of components. The components can be cognitive, sensory, emotional, and motor. We already know that cognitive and motor, we have difficulties, and I wanna add the difficult in sensory integration. When I told you that they are more flaccid and the body is more hypotonical, we have a perspective in a integration sensory that we have more. I will talk later about this. But we know they research less proprioceptive and vestibular than other kids without the T21. The components will make possible activities like brush teeth, get dresses, eat. We have to think that these activities have too many components to be efficient. Like we can write. When we write, I need to take the pencil, and this pencil will be will be force me to take with force and planning micromotors and tweezers handle, and we need to have a good control of gross motor force, and we use two sensory like proprioceptive and tactile for can do this activity. So when I write my name, I have a lot of components working here: attention, um, attention, and the others: attention, planning motor, planning executive functions, and other more. Um, it's the same for get dressed when I need to put the button in the right place, and when I up my arm to put the t-shirt. So I have a lot of components working here. And we don't work just with the simple, but when we are the activities come more complex. So I can sit for you, buy a lunch, go to the groceries, work, and others examples we can think. So occupational therapists work with analysis of activities and with a goal to independence and autonomy for the age group of the child. And with analysis, we observe the integration sensory and the influence in the children T21 life and the influence in the children T21 life. Sensory integration is the organization of sensory inputs for use. Function of learning depends on the child's ability to make use of sensory information in order to perceive sensory information for his environment, integrate this information, and plan and form purposeful behavior. We can see a good organization of sensory integration with this motor's behavior: motor skills, posture control, equilibrium, attention. So a disorder in those skills can give us information about somatosensory, tactile, vestibular, and proprioceptive. Sensory integration assessment, which is performed prior to sensory integration intervention, enables analyzing, systemizing, and interpreting the individual's sensory perceptual motor behaviors. The assessments consists of the assessments of sensory motor process, integration, the adaptation process of the individual, the effects of the maturation and behavior process, and defining the developmental profile. All syndrome generally have all syndrome generally have deficits in eye hand coordination, laterality, speed, reaction time, equilibrium, and visual motor control. Delays in posture react takes place with the delays in motor development. Especially some children with DS need to develop especially some children with DS need to develop strategies in order to eradicate usually sensory inputs, the information of The information of the posture, synergies, and sensory inputs thought integration is important in the therapy approach. The treatment of children with Down syndrome starts from birth, briefly with a multidisciplinary team. It's called early intervention. The child is accompanied from 0 to 3 years of age. Take advantage of neuroplasticity as an ally to intensify child development. Application of early stimulation obtained positive results for the global development of children with Down syndrome. In this way, it will be possible to accompany the stimulate the child from the first difficulties in sensory motor development. It will be possible to prevent injuries and better quality of life for people with DS. In a long-term treatment, which seeks also facilitate and expand the reported of sociability age of the child, it is a particular importance to consider some features that may accompany Down syndrome, such as the presence of heart disease and hypotonia with possibly low initiative, which will mark the child's ability to explore and invest the environment directly influencing their cognitive, motor, and social development. So guys, to end this video, because it's not easy thinking Portuguese and in English in the same time, but we know it spreads, I want to speak about school inclusion, because it's a delicate theme, and the studies show us that when more education and healthy exchange the information about these kids, we can do the difference, and we can make it, let out the capacitism that she can't, and because she can. And we have today strategies, sensory strategies to make explore more attention of these kids, and with the informations what is DS and how to do with the comportamentals, and how to make the child to engagement in the classroom. We can do something with this information, and this is make sure that she or he gonna learn and gonna be what he or she wanna be. Guys, thank you for listening me until here. I will let here my Instagram, my email, if you want can make contact. I am with open arms. Thank you. Bye bye.